Hello friends, welcome to Dentlect, and today our session will be on fungal infections. So let's jump right into the topic. The most common fungal infection is Candidiasis caused by Candida species. The Candida species are Candida albicans, tropicalis and glabrata. Candidal species are normal commensals of the oral cavity. However, they can turn pathogenic under conditions such as old age, immune suppression, diabetes mellitus, HIV, and long-term consumption of corticosteroids or antibiotics. Now let's quickly look into the classification of candidiasis. It's broadly classified into primary, secondary and candida associated lesions. Under primary candidiasis, you have again further classified into acute and chronic, and under secondary candidiasis you have a list of lesions like your familial chronic mucocutaneous candidiasis, your diffuse chronic mucocutaneous candidiasis and so on. And under candida associated lesions we have denture stomatitis, angular cheilitis and median rhomboid glossitis. Now let us see a little bit in detail about the important forms of candidiasis. The etiology for various forms of candidiasis, however, is more or less similar that I've just mentioned before. In pseudomembranous candidiasis, the lesion typically gives a curd-like appearance. That is, when the pseudomembrane is removed, it leaves behind inflamed and erythematous area. Moving on to the next type, which is the erythematous or the atrophic candidiasis. So as the name suggests, there will be more of erythema or redness, and it is differing from erythroplakia, which has a sharper demarcation. And the infection commonly occurs in palate and dorsum of the tongue, especially in steroid inhaler users. Next is chronic hyperplastic candidiasis or chronic plaque type, and this is also known as candidal leukoplakia. So from the name you can guess that this is a white lesion, but the only candidal lesion that is non-scrapable. Next is denture stomatitis. Now let us split the word and see. The first word is denture, so the lesion is related to denture. The second word is stomatitis. The stomatitis can be split into stoma and itis. Stoma means mouth and itis means inflammation. The most common site is the denture-bearing surface of the palatal mucosa. The chance of it occurring in the mandible is quite less because of the constant pooling of saliva. So let us move to the next lesion, angular cheilitis. Angular, here angle of the mouth. And next, cheili means lip and itis means inflammation. So there is infected fissures of the commissure of the mouth which is surrounded by erythema. Then it leads to crustaceans and dry skin which promotes the invasion of candidal species. Next is median rhomboid glossitis. Again, let us split the title. Median means in the middle, rhomboid is the shape of the lesion, glossi means tongue, and itis means inflammation. So this lesion is characterized by an erythematous lesion in the center of the posterior part of the dorsum of the tongue. And this lesion has a superadded candidal infection. So these are some basics about candidiasis. Now moving on to the other fungal infections, first is Aspergillosis. It is caused by a filamentous saprophyte Aspergillus fumigatus, and it spreads through inhalation of spores. The lesions are characterized by yellow or black color ulcer with a necrotic base and typically located on palate or the posterior surface of the tongue. The next fungal infection is Blastomycosis, which is a deep mycotic infection caused by Blastomyces dermatidis, and this is an infection due to fungal spores in the soil. Clinically, this lesion has a varying presentation such as single or multiple ulcers, sessile projections, granulomatous lesion or verrucous lesion. Moving on to the next fungal infection, that is the Coccidioidomycosis, which is caused by inhalation of spores, which is the Coccidioides immitis in the soil. This fungal infection due to inhalation, so it affects more of the lungs, causing acute pulmonary disease, fever, and in the oral cavity you can expect a verrucous lesion with an underlying jaw infection. Next fungal infection that you are seeing here is cryptococcosis caused by Cryptococcus neoformans, and this involves the face, scalp and the neck. Interestingly, the skin lesions appear exactly like an acne, so the lesions are presented as papules, pustules or abscess and sometimes ulcers. In the oral mucosa, it affects almost all the sites and it has a varying presentation such as nodules of granulation tissue, swellings or ulcers. Coming to the last fungal infection, histoplasmosis, which is caused by Histoplasma capsulatum, which is an organism commonly found in bird and bat feces. The infection is caused by inhalation of hyphae into the lungs, leading to pulmonary disorders, and in the oral cavity, nodular indurated ulcerations typically on the palate and tongue are common. So friends, I hope you have noticed that I have not taken a detailed lecture, rather focused only on the MCQs. In case you have any doubts or you want me to take any particular topic in special, then do mention in the comment section below and you can expect future videos. Until then, take care. Bye-bye.